Hello, everyone, and welcome to our GAAPP Academy. And we're so glad that you're here. We are going to go ahead and get started. I know there will be others who will join us here in just a few moments, but we're going to go ahead and get started. I've got a few things that we're going to go over for housekeeping. The first is that we have a question and answer box that is set up. If you have questions for Tonya at the end of this session, if you'll go ahead and just type those into the chat or into the Q&A, we will read those aloud at the end if there's time remaining. And the second is that we have Wordly translation available. So if you'll give me just a moment to get that loaded, I will send that through in the chat so that you'll be able to access that and see that in your own language, which is always really helpful. So without any further ado, I would love to go ahead and turn this over to Tonya. She is our president and CEO of GAAPP. When we decided we were going to do a topic on perfecting your pitch, there really wasn't anybody else that came to mind for this particular presentation because she's fantastic at this. She's fantastic at communicating, getting her point across easily and succinctly. So we wanted her to share all of her knowledge and tips and tricks with you. So Tonya, I'll turn it over to you.
Well, thank you, Stephanie. And it's so great to see everyone. Thank you all for being here. It is going to be a fast-paced hour. We are going to have some interaction with different people actually demonstrating how to deliver their pitches. And I'm really honored, as always, to represent you all as your GAAPP president and as the CEO of the GAAPP team. I want to thank them for their work in getting this all organized and getting us on the line today. So with that, let's dive right in. Hopefully we've got our Wordly translation up and running. Again, welcome to so many of you. I think we've got people from all over the world and all the different regions. GAAPP, as of today, has over 200 patient advocacy groups across the world working together to do really four key things in lung health and immune health: drive disease awareness, ensure that patients and caregivers are adequately educated, as well as advancing healthcare provider education, advocating with governments and with global entities like WHO and global guidelines committees to bring that patient voice forward. And finally, advancing the patient voice in research, ensuring that every bit of patient insight is truly reflective of the lived experiences of those that are impacted by lung health and immune health conditions. And so right there, I just gave you my 30-second pitch of who we are at GAAPP and what we do. And again, I love the work that we do, and I love communicating about this because no matter where I am, no matter who I encounter, whether I'm in an elevator and someone says, "Hi, who are you? What do you do? What's GAAPP?" I have the opportunity to give that really quick elevator pitch of who we are and what we do. And so that's what we're going to be talking about today in perfecting your pitch, not only about your organization, but about your various projects and work that you're doing. So the next slide really talks about, again, who GAAPP is. And I'm sorry, I thought there was one more slide there. The four pillars of the work that we do. I think that may be at the end, but it's okay. You're good. Go back, Steph. Sorry. I think when I start to talk about how do we perfect our pitch, how do we design this in our head and in our heart, it really is connecting with your heart first, knowing what you're passionate about and being able to communicate that is the number one key to perfecting your pitch. Oftentimes, we want to start with the prevalence, the burden, the disease, the impact of those things. And while that's important, it's not as important as leading with your own personal connection or passion to the work that you're doing. So always, always, always connect with the heart first. Have those stats in your mind. Have some of the thoughts around disease burden, disease prevalence, disease cost, because that might come up. But at the end of the day, it's how this really gets you up and going every single day that's most important. Oftentimes, when I'm kicking off this conversation, when it's related to a project, I really want to think about what is the time to act now? Why am I creating urgency? What in this moment in time would lead that potential funder or that potential partner to work with GAAPP on? And so emphasizing that urgency, understanding why time is now and why it really matters to that particular stakeholder is at the forefront of all the pitches that I do, whether I'm talking just about GAAPP in general as an organization or specific projects. And I say this when we're together as a GAAPP family and really reminding us about the why we're doing what we're doing. But that is the thing that oftentimes people connect to. It's the thing that gets their attention. It's not what you're doing so much that matters. It's the why behind the what and ensuring that we're clearly communicating what our why is in everything we do. So the next slide talks about once you've got that built into your own heart, your own spirit, knowing your own why, having that passion, it's about identifying what are the gaps that you're trying to address, what is broken in the system, how you and your organization can be positioned as the solution to that gap. And so let's think about this for a minute. In the regard of GAAPP as an organization, what are we doing that no one else is doing? Well, number one, we're convening you as patient organizations across the space of lung health and immune health. There really isn't any other global patient voice doing that. So that's what is our unique selling proposition. And you'll have something unique for your organization as well. So take the time to think about what is that gap that you're filling and what is unique about your organization and the role that you play. Next, in regard to a specific project, when we're thinking about this, let's say from like one of our education initiatives at GAAPP or our awareness days, we have to be very specific about what we are planning to do and how we will address the gap. So for our awareness days, we know that oftentimes with awareness days, before GAAPP really was involved in this, that we all had our own individual messages and we were singing off of, if you will, a proverbial 200 different song sheets. And so now with the coordinated activities that Victor and his team lead at GAAPP, it really does give us the opportunity to create key messages where we're all aligning and singing off of one single song sheet. Now, yes, there will be different flavors of that. We'll have different translations and different images that may be more reflective of our individual cultures and issues. But knowing that we've got aligned key messages is a specific role that GAAPP has chosen to provide in supporting you as member organizations and supporting the entities like GINA, Gold, and others that are leading the awareness days. So this is how we can define the gap and find our role in fulfilling the gap and positioning our organization for the likely acceptance of whatever we're pitching. The next slide then goes on to the next step in the process, which is translating the science to impact. And you always hear me say, start with the emotion, but then quickly get to the evidence. Simplify complex clinical language. We all are representing now about 25 different disease areas. And so there will be acronyms that are specific to asthma versus COPD versus pulmonary hypertension or atopic dermatitis or chronic urticaria. So make sure that you have common clinical language. And if you're using acronyms, that everyone understands what those are. Now, I can honestly say I don't do this perfectly. There are a lot of times that I get ahead of myself and I'm talking about something at the WHO or with a specific disease area that I'll use an acronym. And then I realize, like FeNO, for example, fractional exhaled nitric oxide. What is that? Everyone may not know. So I need to back up, explain, and simplify that complex language and make sure that we're on the same page. And again, there are thousands of different examples of that in the work that you're doing. So make sure that you're connecting that clinical language and that data to patient stories. Find a way to perfect your pitch in a storytelling format. And that's the way to embed the science, embed the evidence without it seeming so dry, right? So also remember when you're presenting those clinical data points or any statistics to limit that to only 2 to 3 maximum. So if we're talking about a succinct pitch, it's usually 3 to 5 minutes in length, and it is an overview of whatever project or organization you're representing. So you don't want to overwhelm the listener with too many data points. So 2 to 3 max is going to have that most visible impact and resonate for them to remember those key moments of evidence. The other thing is make sure that you are repeating yourself. So, what is the art of communication and communicating well? It is oftentimes saying the same thing 2 to 3 different ways in a pretty succinct time format. And in repeating it 2 to 3 different ways, but the same concept or the same, basic essence of your message is going to make sure that it resonates with the listener. Oftentimes, actually, the statistics would tell us that it takes up to 7 times hearing the same message before it truly sinks in with the listener. So don't be afraid if people don't get it the first time or second time around. Don't feel like you're a broken record by repeating yourself 2 or 3 times in 2 or 3 slightly different ways. That's going to make that impact much more real and much more realized by doing so. So once you've established the emotion, the connection with the heart, and then translated the science to impact and evidence, then we move on to the next step in the process of perfecting your pitch. And that is clarifying your model. So when we get to this step, it's about how your organization works and how it's different. Now, with GAAPP, I always focus on our 4 key pillars. With your organization, it might be slightly different. But for us, that's disease awareness, education, advocacy, and research. And so every time I'm talking with a potential funder, a volunteer, a new organization for GAAPP, a new stakeholder, I really want to key in on those 4 pieces of our model, because every single time I can ladder up the work we're doing or the project that we're pitching to at least one of these 4, if not all 4. So knowing your model and clarifying how your organization operates is really important, and being clear about what they can expect in engaging with you as an organization or in executing a specific project. So again, that's going to be different for each of you, and we'll hear some examples a little bit later. But I think that it's worth spending some time in thinking how you would position your organization. What is your model? What are your key levers, and how you can communicate that consistently and clearly in every single pitch. Now comes what I say is the proof is in the pudding. Anytime I have a pitch, I'm already thinking about how that will benefit the person that I'm pitching to. What are the outcomes? What are the measurable results that, if we are successful, they can count on? And I'm always thinking about this not only from our perspective as GAAPP and what is the win for GAAPP and for GAAPP members, but I'm also thinking about it from the perspective of the person that I'm talking to. So if it's a funder, what is going to be the benefit to that organization? If it is a new member organization, how does being a member of GAAPP benefit them? If it's a professional society, what are the win-win that we can create between patients and providers that are going to be the clear outcomes of the activity that we are proposing? So It's about measurable results. It's about uh, impact over activity, and not just generating like these are the number of downloads, these are the number of participants. It's what take that a step further. What is that really going to mean to the people who come to the webinar, who participate in your event? What are they going to learn? How is it going to change their behavior? What will their knowledge increase be? So these are the really tangible outcomes and impacts that are most important. So finding a couple of those early indicators and communicating that even as you're pitching your project is really an important point of getting that potential listener or supporter to come along with you and to see what the end result will be of the efforts of working together. Now, let's talk for a minute about tailoring our message. The truth is, it's never a one size fits all when you are perfecting your pitch. It always starts with knowing who your audience is, whether that's a pharma partner, a payer like an HTA body, or a commercial insurance payer, a healthcare provider, and even more specifically, is it a pharmacist? Is it a respiratory therapist or a physiologist? Is it a primary care provider or a GP? Is it a specialist? Is it an allergist, a pulmonologist, a dermatologist? All of these understandings of the nuances of your different audiences is going to ensure that your pitch resonates, that it sticks with who you're talking to. So take some time, think about who is that audience and how you can actually align with their interest, with what matters most to them and what matters most to you. Knowing and connecting to priorities of a shared likeness is really what I think is the foundation for any good pitch. When you ask is just as important as what you ask. For example, I know all of the funding cycles of all of our major industry partners. There are about 25 of those today. Some of them are on calendar year, some of them are June to June. And so knowing what those fiscal years are, knowing when their planning process happens, and knowing when to get in our letters of request, our asks for them, our pitches is really vitally important. So it's not just about what you ask and how you ask, it's about when you ask and making sure that you're getting ahead of those funding cycles, especially when it comes to raising funds. Now, with professional societies and policymakers, it's about knowing the timing of their planning cycles, their sessions. So most payers reevaluate their coverage plans once a year. And so knowing when that timing is happening and when we can make the ask of inclusion of a new therapy or asking for prioritization of different disease areas is really important. Also knowing when legislatures are in session and when they might be having votes that are specific to health issues or environmental issues, if that's your ask, if that's your pitch. So really understanding who are the key stakeholders, what are their priorities, what are their timelines, and when you should be asking and putting that pitch forward is really the key to aligning with those audiences. Now, in different parts of the world, we have to change our pitch. We know that there are underserved populations in every single country throughout the world. When we look at rural health versus urban health, when we look at low socioeconomic status versus high socioeconomic status, when we look at education status, these are the different types of underserved populations. So you can think about this at a very local level even at a postal code level. You can look at it at a national level. And certainly we look at it at a regional and global level at GAAPP. And so our strategies are very different for low to middle income countries and the work that we're doing there versus high income or developed countries. Our strategies are different when we're looking at national strategies for rural populations versus urban populations. We're always trying to level that playing field and think about our pitch in patient advocacy of ensuring health for all, right? We want that message of universal health coverage. And in some countries, that will resonate right now. In other countries, unfortunately, just like the United States, equity is sort of a dirty word. It's not a word that's encouraged to use. So we have to find new ways to communicate the importance of creating a more level playing field for everyone to get the right treatment to the right person at the right time with the fewest barriers, and truly use clear, measurable commitments toward that aim of health equity. So, how do we wrap up? I've just spent about 20 minutes talking about how to create a clear pitch, and I'm talking 3 to 5 minutes. So, within all of this, there's a lot of work on the front end to know who your audience is, what's the timing, how we match up with our priorities, what's the primary project I want to pitch, and how can I communicate that in a very clear, succinct way. But don't forget to end with a clear ask. Define what that need is and what you're asking the listener to do. So be specific. If it's a funding need, how much are you looking for? What are the partnership opportunities? Are there defined levels of support? If it is a policy ask, what are you asking them to do? Are you asking them to sign on to a certain bill? Are you asking them to advance or introduce legislation? Are you asking regulators to approve a new product or to put it into a priority position? Being very specific and actionable about what that ask is makes it easy for the listener to respond. Also, being clear about what is the timeline and following up with them in whatever you decide are your next steps. So, is that sending a proposal? Is it actually sending them model legislation? Is it working with them to ensure that there are care pathways or the patient voice included in a data project or in a guidelines project? Whatever that ask is, be sure that it's got a next step and that you're following up within 3 business days of that communication with that timely follow up. I try to not ever let more than 3 days lapse in really following up and saying, I appreciate our conversation. Here's what I heard. I hope you're in agreement with what we, discussed, and that you're ready to move forward with that next action step. So ensuring that we've got those defined, specific, actionable items and that timely follow-up will help to secure the support that you're looking for in each of your pitches. So a lot of times when I'm wrapping up a pitch, I use this kind of language like, why GAAPP? Why now? Reinforcing now is the time because of the urgency of this problem. GAAPP has a unique role in meeting the problem and providing a solution. And by partnering with us, this is the impact that we can have. By working together as the support that we're looking for, that you're looking for, here is what we'll be able to achieve. And then if we do this, this is what you can expect as far as progress, impact, and how we will evaluate that. Most of our projects are 1 year in length. And so much of December is spent just on evaluating the progress of our projects and communicating that back to potential funders. And it's by doing that year over year over year that GAAPP has been able to improve the level of support that we've gotten from different partners and continue to grow in our budget, in our impact, in the work that we're doing in supporting you as member organizations. So I always say, if the first minute and the last 30 seconds are the two most important parts of your pitch, being able to tee it up very well right at the outset and then tie a bow on it at the end of really why us, why now, and how we will drive change, progress, and impact. So I have spoken for about 25 minutes of the time, which is exactly what I was hoping this would take, because I really want to get to your questions and also hear from some of our members on how they actually pitch different aspects of their work. And so I asked some of the GAAPP staff and GAAPP board members to practice their pitches, to share their pitches with us today. And we're going to talk about different target audiences in doing this. And so I asked Migdalia to give us her 3 to 5 minute pitch of how she explains Sarial and the work that we're doing when she's talking to perhaps a new patient organization. And I'm going to ask Migdalia to provide that pitch in Spanish. So it's in her native language. It's most comfortable for her. And we can get the benefit of hearing her do that. So Migdalia, are you on the line?
Yeah,
And
I'm
can we
here.
open up? Great. Awesome.
Are
So
you
if you
listening to
give,
me?
yes, we can hear you
Perfect.
perfectly.
Thank you so much. Thank you so much, Tonya, for this opportunity. I'm going to make my speech in Spanish because, you know. Ok. Hace 5 años solo éramos 15 organizaciones de pacientes dispersas en toda Latinoamérica, intentando mover montañas en cada uno de sus países, muchas veces solos, sin recursos, sin voces en las mesas en donde se toman las decisiones y millones de personas afectadas con enfermedades respiratorias, alergias y atopías. Hoy somos 55 y la pregunta que yo me hago es, ¿y no es cómo crecimos, sino por qué hemos crecido tanto? Y el por qué es porque tenemos una realidad terrible en Latinoamérica y es que las enfermedades respiratorias, alergias y también las atopías son una crisis silenciosa, una crisis que nos está matando de una manera silente, tanto la EPOC como el asma severa, como la hipertensión pulmonar y todo el resto de las enfermedades, alergias y las atopías. Los pacientes esperan años, años por un diagnóstico y cuando llega ese diagnóstico muchas veces es tarde. Y el acceso a tratamientos en casi todos los países latinoamericanos es un privilegio y no es un derecho como debería ser. Sareal nace para cambiar justamente esto. No como un evento más, no, no es un congreso académico más, sino Sareal nace como un movimiento donde los países y donde los pacientes dejan de ser estadísticas y se convierten en arquitectos de soluciones. En 5 años, ¿qué hemos hecho en 5 años? Hemos hecho algo que parecía imposible y es unir a 55 organizaciones de 8 países de América Latina bajo una misma visión. Hemos formado líderes y los seguimos formando y también hemos influido en políticas públicas. Solamente voy a dar 2 ejemplos sobre esto. Costa Rica hoy día tiene un Plan Nacional de Salud Respiratoria y Chile, algo impensable, ya tiene medicamentos para el asma grave, cosa que hace 3 años se pensaba que era un imposible. Y esto pasó, ¿por qué? Porque entendimos algo realmente fundamental, y es que la voz de los pacientes, cuando se organiza, cuando se profesionaliza y cuando se habla con datos y con estrategia, sencillamente mueve los sistemas de salud. Por eso este año, Sareal en el 2026, que va a ser en Panamá entre el 23 y el 25 de julio, no va a ser solo el quinto congreso de la región. Para mí es un punto de inflexión. Van a ser 3 días con más de 40 líderes de organizaciones de pacientes, de 8 pacientes de Latinoamérica, con una agenda construida bajo 3 ejes. Un eje con todos los avances científicos, el otro va a ser un taller de advocacy que va a estar potenciado con inteligencia artificial y alineado completamente a las resoluciones de la OMS y de la declaración de las NCDs. Y por último, un diseño de proyectos ejecutables para hipertensión pulmonar. Pero lo más importante en realidad no son los temas, es cómo los llevamos. Esto está basado en proyectos reales con ejecución real, es la planeación. Esperamos que estas 55 organizaciones de pacientes generen estos proyectos y no se quede solamente en el conocimiento, sino que generen un impacto tremendo. Hoy somos 55 y la gran pregunta es cuántos queremos ser en 5 años. Y también qué es lo que vamos a lograr y cómo lo vamos a lograr. Sareal no es un congreso al que se asiste. Sareal es un movimiento al que se pertenece. Y la pregunta no es si tu organización puede permitirse estar. La pregunta que yo dejo acá es si realmente puede permitirse no estar. Muchísimas gracias.
Muchas gracias, Migdalia. Thank you so much. I think that if I think through the way Migdalia framed this, right? So, number one, she was very clear about who she is, what we're doing, and the shared experience of delay in diagnosis, in access to treatments. She gave some examples of how we have advanced this and how, as a community, we're seeing the changes in Argentina and Chile. So I love the way that she framed the common issue up front, that she created that established experience and the way that we made a difference thus far, and the very clear way of why now is the time, that urgency. You felt that in her tone of voice and heard that in her words. And I think that it's when all of this matches up and marries that it becomes a perfect pitch. It's when people see in your eyes, they hear in your voice, and they also hear with your words what you're trying to communicate. And so I think a really great job, Migdalia, of giving us that pitch to patients. So thank you, thank you, thank you. Muchas gracias. And it was exactly 5 minutes, which was also perfect. So now we're going to move on to Vildana, and I am going to ask Vildana to give us a similar pitch to how she explains the AAA Congress to healthcare providers and to leaders in Bosnia and Eastern Europe. So Vildana?
Hello, everyone. Thank you, Tonya, for this great presentation and introduction. So I'll just share quick pitch about AAS Congress, as well as, let's say, JAK inhibitors, something which we have done recently when we talk about advocating. So I would just greet and say good afternoon, and thank you for the opportunity to meet me. So you probably heard about AA Association in Sarajevo. This is a patient-led organization which is focused on improving allergic, atopic, and respiratory diseases. What I would like to emphasize and what makes us, let's say, different is that we put patients in position not only as a recipient of care, but we really strive and try to put to be a partner in shaping more effective and accessible and sustainable healthcare systems. Let's say. I'll just give you a short brief about what we do and through, let's say, 3 pillars that our organization operates. So just for you to have better inside. So we really care about education and health literacy. We bring patients and healthcare providers to work closely with clinicians and to integrate, let's say, the patient perspective into clinical practice. This is something that we really like to do, and we believe we are very successful in this part. And also advocacy for access to medicines and treatment, something that we are very keen. So when we talk about AAA Congress, this is a unique platform for exchange, for advocacy, for meeting all stakeholders in order to improve position of patients in the region. I'm pretty sure I even remember that you that you were present at one of our congresses. So that is why I would like to invite you and on this panel to discuss about innovative solutions. And as you know, in Bosnia and Herzegovina, access to innovative therapies for conditions like atopic dermatitis or severe asthma has been very limited. And this specifically, what I would like to ask from you is to talk about JAK inhibitors. And we already have structured the approach. So we would like to work closely with clinicians. We would like to engage health authorities for reimbursement decisions. So this is something that we would like to talk together with you in front of patient experts and healthcare providers. And just for your, to mention that we are pretty aware of the healthcare budgets, and we know that they are limited. But I would like to give you an intro that our position is that timely and appropriate treatment can actually reduce overall cost. So we would like to have you together sitting with other stakeholders and policymakers, healthcare providers, and patient experts to discuss and to see how we can improve the position of patients in Bosnia and Herzegovina. So this is a call for future collaboration as well. And we would really value your partnership in your presence at Congress and in future activities in helping patients to access therapies. Thank you very much. You're muted.
Oh, Tonya, you're muted.
Oops. I was stopping. And then I said, I know that sometimes this is not comfortable to do, especially in front of your peers. It can be a little intimidating, but it's so beneficial for us to hear how people frame things and how they put their words together. And so, Vildana, what I thought you did such a great job of is, number one, you had your plan going in, but you didn't have a script. You weren't too scripted. It didn't sound artificial. It sounded very natural. It sounded very collaborative. You built on what relationship was already there, which is always important, thanking them for their current relationship and partnership, but then how we can continue to expand that and take it to the next level. And this is really one of the arts of a perfect pitch. It's not, don't take for granted that they remember what you've already done together. Don't take for granted that they know you appreciate them. Say these things up front and then build on that as you go along. I love that Vildana went in with a very specific aim and goal, which is to invite them to the Congress, make sure they're attending again, and then to work together specifically for the JAK inhibitor access, right? And for innovative access in their country, their region. And we know that this is one of the key ways that patient organizations and healthcare providers can do so and work together. And you've got a proven track record in doing that. So you're building on the successes that you've already had. So really nice job. I loved it. Next up, we're going to go to Kristen. And Kristen is going to give us an example of how she might engage an industry partner in the project work that she's leading. Kristen?
Thank you so much, Tonya. Hi, everybody. Good morning from Washington, D.C. So I'm Kristen Willard, and I'm from We See You, and the CU in that name is chronic urticaria or chronic hives. I know we're a brand new name to you, so let me tell you more about us. We're the only U.S. nonprofit patient advocacy organization that's focused solely on chronic urticaria. We can't call ourselves new anymore. We were founded now just about 1.5 years ago, and I'm so proud of all the things that we've done in that time. Really, at the base of everything we do is that we want people with chronic urticaria to have a home, a place to call their own, whether it's on the internet or meeting us in person or connecting with each other. You know, I am a patient myself with CU that's in remission, thankfully. I've had hives off and on since my 20s, and these became chronic in my 40s. And at no time did I feel like I had a place that I could go to where I could find trusted information or ask questions. And we really can provide that. We know that up to potentially 1.7 million of us exist in the US with chronic urticaria. And now we have a home base for them, and we're trying to get more and more of them here in order to engage with us. So, we do that in a variety of ways. In addition to providing them a home, we're really working to empower them through our main pillars. For us, those are, awareness, education and community, advocacy, and research. What we really want to do is make sure that patients are aware about their condition, they're engaged in learning about it, that they understand public policy and how they, as individuals, can have their voices heard so they can affect change. And we want them to participate or engage in research that, even if it doesn't change things for themselves, it can change things for their larger community. And as I like to think of it, like patients for the future. We know how important it is for them to be involved in whatever it is they'd like to engage in and have their voices elevated. And we want to be those. And my bias is education. That's my background. And we want to connect our community to trusted resources. So in our first year, we were so proud that we were able to launch an AI tool called Scratch. His name is Scratch. And he is a tool that can answer, almost any question about hives. If you head to our website at livingwithcu.org, you'll see this bouncing mast cell in the lower right corner. And so far, hundreds of people have come to ask him thousands of questions, and they get from him an evidence-based answer. And we know that because we CU medical experts built his brain. It's really wonderful. Every article was curated by someone on our team to make sure that he has all the latest information and they're not getting information from what I refer to as the Wild West of the internet. Another gap we have is that it's really hard for people who either suspect they have chronic urticaria or who have chronic urticaria to find healthcare professionals who understand urticaria, and to be frank, to find someone who wants to work with them. And so this year, one of our flagship projects will be to launch a doctor finder that will be more than just a list of names. We really are setting up centers of excellence when it comes to providing holistic care or engaging in shared decision making, making sure that if a name is on that list and on that map, that the patient knows that is a trusted healthcare team that understands them and is willing to work with them at that location. And we're aiming to have one of those in every state within the first 12 months of working on it. I think that's groundbreaking. As a patient, I would have loved to have had that. And I'd love for us to talk more about that, see if we can work on that together. I just know this is a win-win for everyone. So if you would take a look at our resources, again, the website's livingwithcu.org. read all our patient testimonials, our blog posts, see our resources, and try Scratch. And then I will follow up. Today is Thursday. I'll follow up on Monday so we can chat after you've reviewed our materials if that works for you. I really appreciate your time.
Really great, Kristen. Number one, I hope that the other members on the line learned a bit about WeCU and the great work that you're leading and doing there. Number two, what I love about this pitch. So number one is that Kristen had a very clear plan going in. She wanted to, get to the topic of this particular project and the work she was doing, but she gave a nice framework and introduction to who WeCU is, to their 4 pillars, to the work that they're doing, to some of the successes they've already had, even as a very young organization, and how to build on that. So I think just a really nice job on that end. The other core piece that I heard was a clear next step. Kristen, really great job of outlining, here's what I'm asking you to do, and here's the time that I'm going to follow up. And, advancing the ball. The key to a perfect pitch is not expecting that it's a one and done, that you're going to, get everything you ask for in that 1 3 to 5 minute conversation. The key is to keep advancing the ball down the field and to ensure that you've got the next conversation, the next discussion, to leading to closing that pitch. So really, really nice job of giving us those next action steps. And then last but not least, we're going to hear from Riley, who again leads public affairs and government affairs at GAAPP and is previously with the Lung Health Foundation, where he spent a lot of time engaging policymakers. So Riley, take it away.
Thanks, Tonya. I think everyone can hear me okay for now.
Yes.
So first off, when you have a meeting with a policymaker, you want to introduce yourself really quickly and thank them for their time. So thank you for having me today. My name is Riley Sanders. I'm with the Global Airways and Allergies Patient Platform. Today, I want to talk to you about how we can reduce the risk of lung cancer for Canadians. Right now, lung cancer remains to be the top cancer killer in Canada, killing more than breast, prostate, and colon cancer combined. We believe that we can reduce that risk quite easily if we reduce residential radon exposure. Have you heard of radon before, or residential radon? Yeah, probably from your chemistry class in high school. But radon is an invisible and an odorless gas that is existing in our soil. It comes up through cracks in our foundations, and then because of Canada's building codes, because we build so airtight, it builds up in our homes into an unsafe level, which increases your chance of developing lung cancer. Right now, it's the second leading cause of lung cancer, right behind smoking. So it is a major contributor to risk factors here in Canada. Right now, 1 in 7 homes inside Canada have residential radon levels that exceed the Health Canada guidelines. And in your home riding of New Brunswick, it's actually 1 in 3 because of the shield that's there and the way that your soil is built. When it builds up inside homes, your risk of lung cancer is increased, but this is a really, really easy fix. You can test your home, which costs about $50 or $60. And then if you are found to have levels that exceed the safe levels from Health Canada, you can mitigate that risk by sealing the foundation or running a vent pipe from your foundation outside your house to keep your house safe. What I'd like to talk to you and work with your team about today is how can we implement a publicly funded testing program to make sure that we are promoting radon awareness, that we're getting people to test their homes. And then once they are testing positive or at a net level that exceeds that safe level, what can we do to support them to make sure that mitigation is not a cost barrier for them? It costs around $2,000 or $3,000 to mitigate a home for radon. And we strongly believe that we shouldn't be allowing people to allow costs to force them to live in a home that is increasing their chance of developing lung cancer. This cost might seem a little bit high or large when we think about how many people we'd be providing free testing for. But when we think about the cost of treating lung cancer, it costs around $50,000 to $100,000 per case, more if it's just discovered at a late stage. So every time that we're able to prevent one of those cases, we're saving a large portion of the money that we are investing into testing and mitigation. And we would really love to think about that and how we can really make a difference in Canadian lives by lowering the amount of Canadians lost each year by lung cancer and making sure that people's homes are not making them sick or exposing them to lung cancer risk. So I think today I would really like, coming from this meeting, if you could share, I can send you some information about radon that might encourage your constituents to test their homes or learn more. Or if they thought about, they tested high and then chose not to mitigate, maybe they can think about where they can get the support needed to mitigate their homes. And then I would love to work with your team to talk about what a publicly funded radon testing campaign and program could look like. Thank you, and I look forward to following up with you.
Great, Riley. Thank you. So number one, I think that what I loved about Riley is that number one, he was very well prepared. He had his 2 or 3 specific stats ready to share, knowing what the likely objection would be. So oftentimes there's concern about the mitigation, about the testing costs. And so Riley came prepared with like a few key points to go ahead and address that up front. And that doesn't give that policymaker even the opportunity, even if their brain wants to go there with objecting, it's hard for them to say no because he just already addressed the objection before they objected. So anticipation of what those questions may be and being prepared to address those up front is really a beautiful thing that we saw Riley do there. Having the very clear ask at the end and the follow-up timeline. I thought, again, a really very solid pitch in explaining the problem, what is the solution that you're asking, how you can partner, and then what are those next action steps. So I thought really, really good way to communicate. With policymakers specifically, it's hard. Oftentimes you are in a hallway walking from one meeting to the next or in like a standing meeting rather than a sitting meeting. And if you don't get it out in the first 1 to 2 minutes, you're not going to capture their attention or get anywhere in that conversation. So Riley was very succinct. It was less than 3 minutes and it was right on point around his key issue of radon identification, detection, and mitigation. So thanks for that. Again, great job by everybody. I know that's not comfortable. I know I put a couple of people on the spot in doing this today, and I just really appreciate you as leaders in GAAPP stepping up to share your pitches and helping us to learn how we can all do better. Let's be honest, this is something that takes a lot of practice and takes, saying it time and time again. I know this is going to sound goofy, but sometimes I do this in front of a mirror. Like when I am, getting ready for a big presentation or when, I first started talking about who is GAAPP and what we do, I would try to look at myself delivering that and, time myself on a 2 to 3 minute because I want to be able to at any moment in time, whether it's on an airplane, it's in an elevator, it's in a policymaker's office, or in a health provider, setting a Congress, to tell someone who we are, what we do, and why they should care. And so that really is the points that I wanted to make today about perfecting your pitch. And I hope it's been helpful. Hope you've picked up at least 1 or 2 golden nuggets in our time together. And I'll open the floor for any questions that may be out there. You can drop them in the chat. You can unmute yourself.
I had somebody WhatsApp me a question for you, Tonya. They get very nervous in these moments when they know that they're going to have to give their pitch. What do you do to kind of get past those feelings of nervousness or anxiousness?
Yeah, everyone always says this. It is a human that means you're alive. If you get nervous, number one, that means you're alive. Number two, that means that you are doing exactly what you should be doing, right? You're stepping a little bit outside your comfort zone with that ask. So what I always do when I feel myself getting a little bit anxious, whether I'm about to engage in one of those conversations or take the stage to talk, is number one, I do a couple of really good deep breaths. Don't forget to breathe. So, doing what we call kind of the box breath of in for 4 seconds, hold for 4 seconds, out for 4 seconds is a good way to like just calm your nervous system, to settle in. Sometimes I'll shake it out, like I'll actually like shake my arms and my legs and just kind of, okay, I'm okay, like calm down, talk to myself a little bit. And realize that it's not a do or die. Like it's not only about what I say in this moment, it's about how it keeps moving us toward the point of partnering in the way that I want. So it's not a like live or die moment. It's about how do we keep building the blocks to a better relationship, to a better partnership, to securing the win. Okay. So that's how I kind of calm my nerves, get myself back on track, and remember we're playing a long game here. This isn't a sprint, it's a marathon.
Yeah. Yeah. I mean, it is relationship building, and you're not trying to be something that you're not. You are passionate about this topic, whatever it is, you are passionate about it. So it's just sharing that in a way that is really communicated well to the other person. That's fantastic. I have another question here. Are there things that are off limits to talk about in pitches?
So, I often say, try not to start or end with something that could be argued or controversial. But I really don't have a no limit. Like, we're not going to talk about this or we're not going to talk about that. I've never gone into a pitch with that kind of off limits mindset. But I oftentimes do think about what is the curveball? What is the thing that could surprise me in this? And be prepared for that. But I try not to lead with something that's super controversial, make sure we're starting off in agreement, making sure that we're ending in agreement. So if you're going to cover a controversial topic or something that is a little uncomfortable, number one, try to be prepared for what that might be, whatever that curveball may be. And then number two, make sure that it's in the middle of the conversation, not at the beginning or the end.
That is great. And something that I noticed most recently, the last practice session you did with Riley, I noticed that what he said was, a lot of times people are worried about the cost, the cost of the mitigation.
Yes.
But, it's okay to talk about those points, those pain points. So I like
better
the
if you bring them up. It's actually better if you bring them up, just like Riley did. It puts the listener at ease. Like, yeah, this is something that is tough. This is something that we have to think about. And so I think that it's a really advanced way and productive way to kind of bring up those objections.
Right. And it lets them know that you've thought about that, like that you're really thinking about it from their perspective. So you're coming to them with hopefully solutions that you can work together, together towards a goal. Another question in the chat. How do you strike the right balance between emotional storytelling and clear, concise facts when pitching, especially when it's something that is deeply personal or complex?
Yes. So this is hard. This is really hard. I often say, and you guys know this, like start with the heart. I mean, I'm never going to be anything that I'm not, which is an emotional person, right? So know that, and people will expect that from you, but don't let it sit there. So I often say, like, if I've got a 3-minute, 5-minute window, no more than 1/3 of that time is going to be focused on the heart, right? I need to get to the basis of the conversation and the evidence, and I need to get to the ask. So make sure that you're moving that conversation along appropriately. So the other thing is that sometimes when I find myself getting too fired up, And some of you who've been in meetings with me know this, like because I am an emotional person. When I find myself getting too fired up about something, I'll pinch my thumb like under the table, kind of like catch myself, and I'll shut up and let someone else speak. And that's hard to do in the moment if you don't already have the strategy ahead of time. So I try to make sure that I'm balancing the conversation in listening and speaking. But when I'm really getting fired up about something or too emotional, I'll have a little cue to myself to kind of pinch my thumb like this between my two fingers under the table, or shut my mouth and let someone else do the talking.
Oh, that's great advice. But you're right. I mean, you really have to have a plan for yourself going in. So if it's something that you already know is kind of a topic that you tend to get worked up about, good to have that plan. Good to have that in
Yeah.
place already.
Yeah.
That's really great. I think there was a couple of slides after this, Tonya. Were there slides?
Yeah, I think we could just move on. I just wanted to show you guys the new GAAPP overview slide of our 4 pillars and who we are and what we do. So having a one slide like this to tell your elevator pitch is really important. So I would recommend something like this. And then finally, I think the next slide is just about our continuing the conversation, being involved in Knowledge Hub, sharing your learnings and reflections, additional questions from this time together, and staying connected. Like that's the best thing about GAAPP is that we do have an opportunity. We've got a test environment. Like if you want to get on a call and let's practice your pitch, we're here. We want to do that. And Knowledge Hub is a great place to do that as well.
Yes, it's fantastic. And Bruna, our new community engagement person here at GAAPP, has already posted some questions in the Knowledge Hub. So she's looking for answers. So go there, share your learnings, your questions, anything that you want to share about this particular GAAPP Academy today, and we'll be glad to continue the discussion with you there. Tonya, thank you so much. This has been really fantastic. We're getting lots of great comments in the chat, lots of great WhatsApp comments back to you. Really appreciate it. Thank you so much. And I hope everyone has a lovely day.
Thanks, everybody. Thanks to my volunteers. Have a good one.